Probably the biggest climate mitigation adaptation we have isn't seawalls and it's not carbon capture, it's healthy, resilient communities. That's what we're going to really depend on going forward. So I think social prescribing is going to become much more important.
Hello and welcome to another episode of HSE Talking Health and Wellbeing. Today we're going to talk about social prescribing, and we're delighted to be joined by Aleisha Clarke, who is our National Program Manager for Mental Health in Health and Wellbeing in the HSE. And we're also joined by Dr. Sean Owen, who's a full-time GP in County Louth, and he's Chair of the Climate Health Alliance of Ireland. So welcome this morning. Thank you very much for joining us.
Thanks, Noreen.
Thanks, Noreen.
So social prescribing is a relatively new service that we're providing in the health service, Aleisha. So can you just explain to the listeners what exactly social prescribing is? Because it's a new word really for people.
Absolutely. So social prescribing, it's a freely available service that's funded by the HSE and provided by our community partners, which connects people to supports in their local community with the help of a social prescribing link worker. So the overall aim, I suppose, is to address people's social, emotional and practical needs. So a person is referred in to social prescribing by their GP or their health professional, or indeed they can self-refer into the service. They will then meet with a social prescribing link worker who will work with them to understand their needs and their goals, and they will work together to co-develop a personalised health and wellbeing plan. And this will inevitably involve some kind of referral into a community group or community service. So for some people, their goal might be around, I suppose, becoming more active. For others, it might be more around connecting in with people in the community. So a link worker might support them in joining particular community groups, for example, a gardening group, volunteering group, a cooking class, mother and toddler group, or a park run. For other people, it might be more around looking for practical information in relation to housing, finance, and education.
Can they not just go online and find all that information out? I mean, what's so special about social prescribing then?
In terms of social prescribing, it's the link worker. Firstly, in terms of taking the time to really understand what an individual is going through. Secondly, in terms of their knowledge of the supports and services that are available in their community. And then thirdly, I think around supporting them in providing that help to an individual to follow through with these services. For some people, the support might be as little as linking them in with, we'll say, exercise class. But for other people, it might be that bit more involved in terms of maybe accompanying them to their first exercise, just to get over that barrier and that kind of perhaps lack of confidence.
So the link worker has extra time to spend with that person and to create something individual for them.
Absolutely.
Depending on their needs at that time.
That's it exactly, yeah.
That's brilliant. And Sean, do you use social prescribing in Louth very often, or how is that service going there?
It's about 2 or 3 years old now and it's going really well. Our link worker is called Danny. Shout out to Danny. And it's supported by the Louth Leadership Project. So it's going really well and use it on a daily basis. I always think about the referrals, that is to say. Just speaking to Aleisha there before we come on, there's a number of academic GPs who've done lots of research on social prescribing in the Irish healthcare setting, have embedded it in their practices. So really just more to say, I'm a full-time GP and yes, I have an interest in planetary health and climate and environment. And that is to say, this is regular primary care, evidence-based medicine, and is really, as Aleisha said there, to meet people's emotional and well-being needs more holistically. So it's become part and parcel of the care that we provide in our practice.
Okay. When you say social prescribing, you think of a prescription because you're thinking of medical prescriptions. So how does it differ?
Yeah, I was thinking about that, and probably best to flip it round. I mean, why wouldn't we have a way of prescribing to people's social needs? So it speaks to a broader issue is that the medical system, whether it's the curriculum or postgraduate training or continual professional development, has a huge influence from pharma. And what happens is we are given these very effective hammers, if you like, but quite soon everything becomes a nail. And some interesting research from Citizens Advice in the UK a few years ago found that maybe 20% of all GP consultations are for non-medical needs.
That's a lot.
Yeah, and I think any healthcare providers listening, that would sound familiar. Like anything in Ireland, you can link it back to Father Ted sketch, I think. And I'm thinking about Father Ted goes to the Garda station and he says, I'd like a lasagna, please. And the guard says, I think, you're in the wrong place. I'm guard. All right, I'll just have some chips and a Fanta. And quite often, people are saying, I have a mood disorder or I'm stressed about this, that, the other. And when you take a good history and you do some active listening, you find that really these are social issues. And then you have to say, well, am I best placed to solve this? Do I have the time? Is this the right setting? And is there somewhere you could go to further explore this? And that's really
Yeah.
what it's about. So it's not really reinventing the wheel. I mean, as you said, this is a relatively new term, but it's not a new concept,
Yeah. And Aleisha, did you want to come in there?
Yeah, I think to follow on to that, if you take the example of loneliness and social isolation, we know that that can have a significant impact on our cardiovascular health, our brain health, our mental health. And I suppose on that point of medical prescription, I suppose, is likely to have limited impact in terms of addressing loneliness, whereas social prescribing can really make all the difference with the support of a link worker, the individual being supported to engage in activities that provide that sense of meaning and that kind of connection in with their community.
Yeah, absolutely. So, Sean, it could have a really good impact on the number of people coming to the GP on a recurrent basis then.
Yeah, just something that springs to mind was through COVID, of course, a lot of people who were elderly and isolated didn't present to the service. And we have a really good relationship with Alone in Dundalk. And I mean, I'm certain that they saved lives throughout the pandemic, but they
Yeah.
also had a meaningful impact on tertiary care services. I suppose the differences are, were we linking our patients up through Alone, or were Alone going out there? So it's about that link work to say, well, actually identify that you may have emotional needs. Here is the number for Danny. He will get in touch with you and we can explore this further. So it's about bringing it all together. And the Tilda study is really famous to say that isolation can be as pathological as smoking.
Yeah.
So it might seem like a soft intervention, but this is a hard impact on ED attendances, morbidity, mortality. And just to say this hammer nail analogy, I mean, medicines work really well and it's not either or, but like academia, healthcare is all about asking the right questions. So someone comes in and they might feel a little bit low. Okay, are you low because your serotonin levels are low? Well, there's a medication that would help with that. Or are you low because of financial distress, relationship issues, employment issues? That other part that, as I said, we might not have the soft skills, time, setting to explore. So it's a way of saying, go and speak to this person and see how you get on. And it doesn't always stick, but quite often it does. And the results when they do are really encouraging. And that's what sustains you, really.
Yeah, I love what you said there about the soft intervention with the hard impact. I think that could be a strap line for us, Aleisha, on the whole social prescribing, because it is a difficult concept to come to grips with. And you said the impact. Sean, have you got examples of people maybe who has used the social prescribing service that may have benefited from it?
Well, I mean, the one that always springs to mind is the first referral ever made, which was a young woman. She was a young mother, estranged from her partner, living alone with a toddler, worked part-time in a supermarket, and was one of these characters, Aleisha, that is a shoulder for everyone else to cry on. And came to me in just profound distress. And again, I found myself, well, I am on the clock here. I'll actively listen, but there's a lot going on. And that's where we ended. It was like, there's a lot going on. I can see that you're really struggling to make ends meet. Probably the best intervention for anxiety is exercise. Where does that fit in? It's a hard leap to get inside 15 minutes. So will you please speak to Danny? And she did engage with him. It took a few months. And Danny provided a free gym membership, signposted to some counselling services. And I always remember when she came back. Now, this is about 6 months later, just brand new. Felt like a new person coming in through the door. And being honest, that's not something I could really have offered. I don't believe a medical prescription would have got there. She didn't want a prescription. So again, it wasn't either or. And another example that springs to mind is the most recent one, which was someone who was neglecting their mortgage payments, putting it under the carpet. And it's not as simple as, well, you've got to engage with your bank. We've got to explore this a little bit further, and has spoken to Danny. And actually, there's a lot of other kind of traumatic stuff in the past, and it's all been sort of put out on the table. And it's gone from weekly phone calls on my end to the occasional chat with the social prescriber. How is that person getting on? We're doing A, B, and C. And it's just really rewarding to see this person come on, and it saves me time. I'm really sustained by it, like I said, and it's just a service that's working. I would call it high yield, low tech.
It's so great to hear. And the examples that you use there are young people.
Oh, yeah.
When you were talking earlier on, Aleisha, I was thinking, is this just for older people? So they're really good examples from Sean. Can you give us examples of people who maybe should access or could access social prescribing?
So the service it's freely available for anyone from the age of 18 who feels that they could benefit from it. When we look at the reasons for referral from our social prescribing data, we can see that 65% of service users who are accessing the service were referred in for reasons of social isolation and loneliness. About 15% are referred in for mental health reasons such as low mood, anxiety, and about 8% for long-term health conditions. But I think as Sean mentioned, there's just so many reasons why, like it can be for more practical information.
Yeah. And just for our listeners, Danny is a link worker who works with Sean, as Sean mentioned earlier on. So I think we all need a Danny in our lives by the sounds of it. He sounds incredible. And Aleisha, when did this start or how did this come about?
Social prescribing started in Ireland, like in most countries, as a ground-up movement, which was being led by our community and voluntary sector with the support of the HSE. So a pilot programme was originally launched in County Mayo back in 2012. And this was really about a local community getting together to address some local needs. Very quickly, we had another pilot initiative launched in Donegal in 2013. And if you fast forward to 2024, we now have 46 HSE funded social prescribing services right across the country. So last year we had over 5,500 adults access the service. And really, I suppose it's our community and voluntary sector. So that's the likes of our family resource centres, our local partnership companies. They've been instrumental in that expansion of the service right across the country. So our link worker is based in these community organisations, the family resource centres, partnership companies. And in some cases, you have link workers who are based in one day a week, perhaps in primary care centre or GP surgery. And that's designed to really try and strengthen that referral process from primary care through to social prescribing.
That's an incredible number to have gone. So it's been around for 10, 11 years, but it's taken this length of time to get it really into the mainstream.
That's right.
And you're monitoring it all the time, I'm sure, the impacts of it.
Yeah, for us, it's about growing the service not too quickly. We do want to ensure that we're delivering a quality service as we grow it. It's always that fine balance between ensuring that we are growing the service, but also ensuring that we deliver a quality service.
Okay. And Sean, what would you say to GPs that are listening about social prescribing and to encourage them, I suppose, to refer on to social prescribing? You've seen the benefits of it, but if people haven't used it, maybe they will think of it as that kind of soft impact area and wonder whether or not it's worthwhile in some areas.
I would acknowledge, it is a bit of a culture shift and it's hard to rewire like this medical model I've kind of described. I still find myself going straight for the prescription pad, and my background was in pharmacy, and it's easy, and there's a expectation sometimes from the patient, and sometimes there's an expectation that that's what they expect, and you have to unwind all of this.
It's like you go into the GP, if you don't come out with a prescription in your hand for the pharmacy, well, was it a wasted visit?
Yeah, there's a nice line in that Citizens Advice report which says, people don't divide their problems up into little boxes. We turn to the nearest healthcare professional for advice. And that's me in a shop. Whoever's in a uniform, you come and help me. So it's about way of divvying those tasks up. As I said, not either or, but the benefits really are profound, not just for yourself as a provider that you're addressing this person's needs, because you'll be seeing them again and again and again. There is some evidence that it can reduce reattendance rates, ED rates, and these kind of things. But moreover, there's the wellbeing aspect. It will improve the autonomy of that person if they engaged, improve their quality of life. It's very cost effective, not just because you may not prescribe something that needs to be reimbursed, but again, reduce attendances, improve quality of life. There's the community aspect, because I always feel like community is like a flywheel. The more you use it, the more you endorse it, as opposed to atrophy. There's a community resilience aspect. There's a better behavior change once they're engaged, because the typical consultation can be quite linear. There's a lot goes on, of course, and every part of it has been studied and evidence-based, but it's two people. There's an exchange. When you introduce a link worker and then a voluntary organisation or two voluntary organisations, the model becomes much more complex, and complexity leads to resilience often. So that's something that you want. And I think that's where all of the multitude of benefits come from.
And Aleisha, so if GPs are listening, or if people are listening, how do they access the service? Do they self-refer? Does the GP have to refer? How would they get in touch?
So self-referral is absolutely an option. A GP or healthcare professional can also refer a patient into social prescribing. So the easiest way to do this, if it's self-referral or if you're referring a patient, is to link in directly with your local social prescribing service. You can find their contact details on the website www.allirelandsocialprescribing.ie. So if you go into that website, you can then search by county, and then the details of your local social prescribing link worker are provided there.
That's great. And you just get in touch with them and they'll call you back or whatever.
That's right. Yeah.
That's brilliant. And Sean, I know that you're the chair of the Climate Health Alliance of Ireland. And I was just wondering, from a sustainable healthcare climate perspective, what are the benefits, do you think, in that area for social prescribing?
I guess important to not pathologise medicines, investigations, medical treatment. They serve a purpose. But there is a concept known as over-medicalisation, and there's harms from that. And we don't see them typically. I would divide them into upstream and downstream. So like any kind of commercial product, there's a global footprint to medicines and interventions. The raw materials might be sourced from all over the world. They're shipped from here to there. Of course, we produce a lot of medicines here in Ireland. It's an important part of our economy. But at every stage, there's not just a carbon footprint, but a waste footprint, a water footprint. And then downstream, particularly antibiotics and hormones find their way into the water supply, into soil and so forth. Healthcare Without Harm have done some really impactful work here to say, well, that has a harm, that has a legacy. So it's about really bringing that into our decision making, which again, it's a culture shift. We estimate that of all of the emissions in Ireland, about 5% come from healthcare. So there's a bit of a paradox going on here that the healthcare that we provide today has a harm attached to it. Not to say we shouldn't provide it, but it should be part of our decision making. And if we can provide evidence-based, practical, local, non-pharmacological solutions beyond signposting, then that's a huge win for the environment. And probably the biggest climate mitigation adaptation we have isn't seawalls and it's not carbon capture, it's healthy, resilient communities. That's what we're going to really depend on going forward. So I think social prescribing is going to become much more important.
So Aleisha, I really think that from what Sean has said, that we can say that social prescribing really will make a difference here.
Yeah, so I think what's really nice about social prescribing is that it's not about what's the matter with you, it's about what matters to you. What are your goals? What are your aspirations? So it focuses on, and Sean has mentioned this, it focuses on the individual needs in a really holistic way. So looking at what supports we can put in place to boost and to enhance your mental health and wellbeing. I think what's really nice about social prescribing is that it connects in with services and supports that are already in the community. And I suppose the other aspect is that strong emphasis on building social connection, building strong communities and resilient communities. So developing that sense of belonging and that sense of purpose in our community. We all have appreciation of the importance of social connection for our mental health and our well-being as a result of the pandemic and that experience of isolation that affected, all of us to some degree.
Yeah, and Sean referenced that area as well about the pandemic. And so all the way along, I guess you're going to have to build the evidence to try and build this again, to keep making sure we can get more link workers and we really can make this work across the country.
Absolutely. Like in terms of the evidence of the ground, it's really powerful when we hear, examples from our link workers and our service users when they talk about the impact of social prescribing on mental health outcomes, physical health outcomes, quality of life, community connectedness. But I suppose when we look at the international published data on social prescribing, it's fair to say that we have more work to do in terms of investing in high quality research, evaluating the impact using robust methods. And I think one of the challenges is social prescribing is a complex intervention, which is addressing multiple outcomes. And that type of intervention doesn't necessarily lend itself to, your standard evaluation methods, such as randomized control trials. So in Ireland, we recently invested in a realist evaluation of social prescribing. And this is about trying to understand how our social prescribing service is working in an Irish context. For whom is it most effective? And under what circumstances is social prescribing most effective in Ireland? And this will really help us to, I suppose, strengthen our understanding of the service, but also help to inform future policy and research in this area.
Yeah, that's really good. So, Sean, what kind of training or resources do GPs need to be able to start or incorporate social prescribing into their practice, do you think?
I think we've already started now. On Earth Day last year, the ICGP, the Irish College GPs, produced a toolkit called the GLOSS Toolkit or the Green Toolkit about how to provide sustainable healthcare, and a major strand was social prescribing. So it's up there and it's endorsed. We also produced an infographic. Again, social prescribing was a great way to demedicalize the healthcare system. But yeah, I think we need a bit more from an undergraduate perspective. It shouldn't be defined in the primary care context. It should be throughout the community and starting in hospitals, as in St. James's. They have a fantastic mapping project already published. And you would need continual professional development. As Aleisha said, we need better research and a real focus on it. There's lots we could do at an individual level. So, if I was a GP listening to this and said, I'd love to get involved, just reach out, find who your local link worker is. Every county should have one now. Have that team lunch. And there's loads of ways you can make the referrals now. So there's a new chronic disease management program where there's a care plan that is mandatory to fill in. And you can fill in as you wish, along with the patient. But social prescribing is a really useful tool there to say, well, I would like you to know a little bit more about health eating, a little bit more about resistance exercise or access to nature. Go and speak to whoever your Danny is,
Yeah.
Or, if you've got a registrar, they could do a local mapping project to see what's out there. But yeah, just get involved because at the minute, it's a bit of a blank canvas, which is really exciting. But it would be great now if all of the various healthcare institutions really come to terms with it a bit more and give it the attention that it really deserves.
Yeah. And Aleisha, it sounds like we have a lot of work to do with it. But what do you see as the future for social prescribing in Ireland? It just sounds like it could have such a huge impact going forward.
Yeah, I think we feel optimistic about the future of social prescribing in Ireland, but there certainly are a number of priorities for us. So firstly, in terms of continuing to deliver a quality service, and that includes looking at the training that we're providing our link workers, but also the provision of ongoing support that we provide to link workers. So, including the likes of supervision as part of their suite of training and support. We do want to strengthen the referral pathways into social prescribing, so to make it easier for our GPs and healthcare professionals to refer into social prescribing. We are keen to continue to grow the service and to address some of the gaps in service provision across the country. We do need to continue to invest in the research side of things to understand its impact. And I suppose another area that we're quite interested in looking at the moment is the potential of social prescribing to address the needs of young people. We know issues such as loneliness, mental health difficulties. They're, a huge concern for young people and their families. And there's quite a nice number of pilot initiatives that are happening in the UK that we're keeping an eye on, just looking at, how that service for young people is developing in the UK setting.
Yeah, and you could really imagine it working in colleges.
That's
and
right.
Universities around the country.
Yep.
Even though it is for people over 18, but if there was a focus on that area as well, that'd be really good for young people. So we've two groups of people that we're talking to today. We've got our healthcare professionals, and we're saying to them, reach out and find out more about social prescribing. But then we have the patient themselves, or the service user, or the person who's sitting at home who thinks, God, I've never heard about this. Maybe this could help me. I'm really not feeling great. I don't know what's wrong with me. It could be a young mother. It could be somebody who's just retired. It could be anybody really who just feels disconnected at the moment. And so the advice would be to go to the All Ireland Social Prescribing Network, find your link worker and give them a call. So that's what we're encouraging people really today. We'll finish up shortly, but is there anything else that you wanted to add to the conversation?
There's a very eloquent writer in the UK, a GP called Margaret McCartney, and in her book about palliative care and the challenges that we have, she writes, we cannot divorce our social circumstances from our health. I think that says a lot about over-medicalisation and the opportunities to address what really matters to people, as Aleisha says. Social prescribing isn't anything more than that. It's, as I said, it's a really low-tech but high yield. It may seem like a simple referral process, but what's going on under the hood is really complex and quite wonderful. Like I said, it's a blank canvas at the minute. I'm very excited about it. And when you get the right link worker and it lands with the patient or the service user, the results can be really transformative.
Yeah, and you've really explained that. And I think, Aleisha, what you said there that's just such an important line. It's not about what's the matter with you. It's about what matters to you. And I think that is just so key. And I think these link workers use that quite a lot. Aleisha, we're coming to a close now. So was there anything else you wanted to add for our listeners?
I think just a final note on if anyone is listening and thinks that social prescribing is of interest or, might be a good fit for them, would encourage you just to go onto the All Ireland Social Prescribing website to look at the contact details for the link worker in your local area and just to make that call, just to reach out. People won't regret it.
Thank you very much. Thank you for joining us on today's episode of HSE Talking Health and Wellbeing. I hope our discussion on social prescribing has provided you with valuable insights in how to connect with your community supports, Connecting with these community supports will positively impact on your health and well-being. Remember, social prescribing, like Aleisha has said, is not about what's the matter with you. It's about what matters to you. It focuses on your individual needs in a holistic way. If you're interested in exploring social prescribing or would like to learn more, please go to the All Ireland Social Prescribing website and look for the link worker in your area. As always, stay tuned for more episodes where we'll continue to explore ways to improve our health and well-being together. Thank you for listening.